Our highest way of finding truth in our society is calling witnesses under oath and then having an impartial trier of fact make findings of fact. There were 2 trials in which there was big, hey, did Ezekiel have bacterial meningitis? Trial number 1, no, Ezekiel did not have bacterial meningitis as a finding of fact. Trial number 2, no, Ezekiel did not have bacterial meningitis as a finding of fact. So why do we have Dr. Sharma claiming that Ezekiel had bacterial meningitis when in 2 trials there was a clear and specific finding of fact that Ezekiel did not have bacterial meningitis? So what medical treatment's being delayed here?
When the word meningitis comes up, I mean, that can trigger some emotion for people. Like, it's some seriousness. Do you recall at one point in time in 2019 when you were cross-examining Annie Savageau, wherein she had stated that the viral meningitis that was found at time of autopsy wasn't even progressed enough to have caused, just to rule it out, just to say it was not the cause of why Ezekiel needed to get into an ambulance? Do you recall that it was not progressed?
Well, I may not recall the exact testimony but I mean, she was clear. She listened to the 911 call where you can hear Ezekiel breathing, and she was clear. That sounds like a partial obstruction of an airway caused by croup. Can we talk about the elephant in the room?
Yeah.
So, yeah. And I mean, really, people should go back to the first trial and listen to the audio tapes of the paramedics where one of them is crying on the stand because Alberta Health Services, all the ambulances in southern Alberta have 3 different ways of getting an airway. And they're all fully stocked for any age from birth to, 100 years old. And some bureaucrat or bureaucrats make the decision. This is a deliberate administrative decision. Well, let's destock the ambulances of all 3 ways of getting an airway for anyone under the age of 12. Mm-hmm. And the paramedics are telling management the first infant we get that needs an airway is dead. The first infant we get, they're begging, they're sending emails. Like, this isn't a secret. You're an ambulance, you're emergency services, and if you're going to get an infant that needs an airway, so for a full year, the paramedics are complaining. And that's why I forget which one was crying on the stand, but I mean, was just so upset about what had happened. And then what was it? 3 days after Ezekiel's death, they're all magically restocked.
Within the week.
You tell me that somebody at Alberta Health Services, someone or several people, are not guilty of criminal negligence causing death. So just so your audience has the context, so Health Canada is moving to take away all of our natural health products with, basically finally getting their long-term wish to fully regulate them 100% the same as chemical drugs. And the goal is to get rid of the products. So the public is putting pressure on the Standing Committee of Health. And so they call this special hearings to be asking these questions. And so it's in this context to basically justify taking away our natural products that all of a sudden Ezekiel is used as one of 3 examples. And none of them sounded like very good examples. And, really? So wait a second. So Ezekiel's in distress, and the mother Colette is doing CPR while you guys are driving to meet the ambulance. And we all know that there's a 911 call. He's coaching her. We all know what's happening. So he's in distress. He does need an airway, and because the equipment wasn't there, it was a full 8 minutes and 38 seconds according to the ambulance records. 8 minutes and 38 seconds when he's already in distress, from an oxygen. He's been on CPR. You tell me that that's not the cause of death. Well, the chief medical examiner found that's the cause of death. So the cause of death was they couldn't get an airway for too long because they had destocked the ambulances. So I'm trying to figure out the logic here, Dr. Sharma. So if somebody commits criminal negligence causing death by destocking ambulances of vital equipment, and then an infant dies because of that, then that is because of a natural health product or parents being reluctant to go to engage the medical system. I'm just, the logic's not clear to me, David, here. Maybe I'm one of these people that just can't see things that are obvious. And I really say, how dare you, Dr. Sharma? How dare you? Really?
Right.
So he didn't have bacterial meningitis and you're pretending he is. You're using this publicly in the Standing Committee of Health. It is a specific talking point that you have chosen as one of your 3 examples. So you have chosen this, and he didn't have bacterial meningitis, and you can go and look at the slides yourself, but you won't because you're afraid of what you're going to see. David, you know about the Truehope trial because you were there. You watched the whole thing, including the judgment, where, we basically have the judge saying that there would have been more deaths in the oral judgment if Truehope had listened to Health Canada. So, here we have Health Canada restricting access to Empower Plus for a short period of time by seizing it at the border, and we have a number of deaths. And the court acquitted on the basis of necessity. You were basically Truehope was saving lives by leaving the product on the market despite Health Canada's objections. I use Strauss as an example. That's a product that has saved tens of thousands of Canadian lives. So these are just picking 2 products that I've run court cases on. So, but there's product after product after product where people are only alive because of them. And we're going to take those off the market because she can come up with 3 off the wall examples. So basically they're bringing in what they call a self-care framework. And when this is fully implemented, we will lose basically all of our products. Like there'll be some multi-ingredient vitamins and some single ingredient products, but it'll be like the European model. Like you try and find a health food store in anything but a large city, and they just don't have, things in the dosages that we have and the multi-ingredient. Like it's not there. And that's where we're moving, where basically we don't have effective natural health products. And so how are they doing it? So first of all, they're going to fully harmonize so that we have to comply with the chemical drug regulations that everyone who's ever looked at this says don't apply. So we're not going to be able to use traditional use evidence for efficacy claims. Well, there goes our industry right there. Cost recovery, so paying for site licensing and product licensing. There goes our industry right now. Censorship of truthful health information. They basically are not going to license under this new scheme products for which you would seek medical advice. Well, now there goes all the products that are natural practitioners use, homeopathic doctors, naturopathic doctors, traditional Chinese practitioners. So we're going to lose access to those treatment models and find ourselves in a chemical drug model. And it's funny, if I do a podcast and let's say we have, it's for naturopathic doctors, like in the chat and questions, oh, that's okay, we'll go underground and just have illegal products. No, you won't. They just imposed the chemical drug penalties. So it used to be you were facing a $5,000 per offense maximum fine, and now it's $5 million per day you're in violation. They'll squash you like bugs and make examples out of you, and everyone will back down. And we're done. Like, this is the end game. So, but we're going to stop it if we all get together and stop it. So can I plug NHPPA?
It's absolutely appropriate to do so. And right there, I was ready for you. Okay.
So David has put the website address, and NHPPA stands for Natural Health Product Protection Association. It's a federally incorporated nonprofit association that I helped form in 2008 and have been with ever since. And we're basically the only, which is surprising because there used to be several freedom groups in the area of natural health. but we're the last surviving one and the one with the most history and expertise. And we're creating a citizen rebellion. So go to the website, and there's several things I need you to do. You will get almost like a cookie bar, but a volunteer bar. Like, go to our volunteer form and volunteer, because we need volunteers. Also, there's a contact us form where you can give us your email address. Please do that, because we launch campaigns, and this is how we let you know. And follow us on social media, and then also support us financially, because we're having to hire more staff and create things, because this has to be the largest citizen rebellion in our lifetime if we're going to win. And it's just because the Department of Health is so powerful that the only way we can get any government, it doesn't matter what party, the only way we can get any government to back down is if the politicians can credibly say to their masters, like, we can't function. You got to let this one go. Like, come back in 10 years. But like, for right now, you got to let this one go. It's the only way we're gonna save this.